Why do doctors withhold information from patients? Imagine you're sitting in a doctor's office, waiting to hear about your health. Suddenly, you notice the doctor hesitating or holding back details. Why might that happen? It might seem confusing or even frustrating, but there are reasons behind it. Doctors are guided by core ethical principles, and one of the most important is veracity. This principle means doctors should tell the truth and be honest with their patients. But sometimes, they withhold information to protect the patient from harm or to respect their wishes. One reason is called therapeutic privilege. If a doctor believes that sharing certain information could cause serious psychological harm, like severe anxiety or even suicidal thoughts, they might delay or withhold that information. This is a very narrow exception and must be used carefully to avoid abuse. Another reason is respecting what the patient wants. Some patients might prefer not to know every detail about their illness or prognosis. If they are competent to make that choice, doctors may honor their wishes to avoid causing unnecessary distress. Doctors also consider how to communicate complex or upsetting information. Sometimes, they break it into smaller parts or wait until the patient is ready to hear the full story. This helps patients process the news better and feel less overwhelmed. Family members can also influence what information is shared. If a family asks the doctor to withhold a diagnosis to protect the patient, the doctor must weigh the risks and benefits. Usually, honesty is best, but in some cases, protecting the patient from harm might take precedence. Despite these reasons, the main goal remains to be truthful. Open communication builds trust and helps patients make informed decisions about their health. Doctors are encouraged to ask patients how they want to receive information and to be sensitive when sharing difficult news. They should also consult ethics committees or colleagues if they are unsure about withholding information. If a mistake happens, full disclosure is always the right choice. In the end, doctors try to balance honesty with compassion. They aim to protect patients from harm while respecting their autonomy. This careful balancing act is what makes medical ethics both challenging and essential in healthcare today.